And I want everybody to really understand a few issues about a public option. No mandated insurance. That means the private insurance companies have a captive audience and their profits grow. Whatever we want to do here, whatever comes out of Congress, we want to diminish the power of the private health insurance companies, big pharma, and the high tech medical industry. We want to diminish their power. Right now, they have too much power. They own the Senate. And they own a lot of members in the House, too. So we want to diminish their power. So no mandates. We do not want to leave it up to the private insurance companies. Multiple times in the past, they have promised to cut costs, like they just told Obama that they would cut several $trillions in the next year from the healthcare costs. Don't believe them. They are liars.
This is a doctor talking. She
There's
should know.
no question about that. They've promised it in the past, many times in the past. We've gone to them and asked them, and they have not been able to control costs. Their costs are their premiums are escalating. Premiums in Massachusetts under the captive Massachusetts plan, meaning they forced everybody to get insurance, actually went up 25%. And it just came in 2006. This was a 2006 reform, up 25%. So they are not going to control costs voluntarily. You can just forget about that. Big pharma, not going to control costs voluntarily. So the public option has to be a strong public option that lets us basically buy into or get folded into one of the existing plans, like Medicare or Medicaid, one of the existing federal plans. And it has to be able, no mandates, it has to be able to negotiate with big pharma and big medical high tech.
When you
sure.
say it, the public
Public option.
The public option part of it needs to be able to negotiate with
Absolutely,
pharma.
absolutely.
Okay.
The kind of thing that Medicare Part D has prohibited, which did not allow Medicare, to negotiate with big pharma. That cannot be in the bill.
That's the gap in prescription drug coverage that leaves people responsible for thousands of dollars in drug costs while still paying their Medicare Part D
right.
premiums.
Right.
Okay,
that basically siphoned off money from the public pool, taxpayer money, to subsidize big pharma. We do not want to, whatever comes out.
Time is to correct that.
Right. Whatever comes out. We do not want to strengthen the health insurance corporations or big pharma or the high tech.
And many of you may, like me, get stuff into your email box that purports to talk about this issue. And it is a bit confusing, so I'm really glad you're here to speak straight about it. There's also a number of opportunities coming up. Jan Schakowsky's holding a town hall tomorrow, which we'll talk about, and I know you're going to attend that, right?
Yeah. Yeah.
And we do have a day of service day of National Healthcare Day of Service event coming up in June 27th, Saturday, June 27th. So that's 2 weeks from now, and that's under Obama's Organizing for America organization. You can sign up for that. So this is the time.
Can I put out some?
Please.
Okay,
yeah, I know you've got a lot of events.
There's actually several things. So I'm going to go through actually very seriously what I recommend people call for, but it is very important to continue to put out there the idea that we can have a single-payer healthcare system. It may be delayed right now because of the political structure, but we can have a single-payer healthcare system. We deserve a single-payer healthcare system. There's no question about it. Every other industrialized country in the world has a type of single-payer national health care plan. Every other one. We're the last ones. We're like, we're like slaves or something here in America. We really are. We have to say to ourselves that we deserve what every other country has. Now, so it's very important to educate about single payer, but then to educate yourself about a little bit more of the nuances of what a public option might be.
Please.
Okay. Mm-hmm. So there are some single payer rallies and things that I do want to put a call out for. There is a single-payer rally in Washington and that is Thursday, June 25th, 10 a.m. at the National Mall at the Washington Monument. And I don't know if there's any buses being organized yet from Chicago, but you can go to www.Payer, Payer.net. www.onepayer.net. So that's Thursday, June 25th, 10 a.m. at the National Mall. Today, there's a very, very important meeting with the unions and the Oak Park Coalition for Peace and Justice and lots of community organizations that have signed on to this. It is from 12:30 to 5 at the Workers United Hall at 333 South Ashland. Workers United Hall at 333 South Ashland, and it's a new deal. They're going to talk about how to make it happen, a new deal, and they've got a 4-platform agenda: end the militarism and cut the military budget, the Employee Free Choice Act, single-payer health care, and end the foreclosures. So that's a very serious economic platform for.
Is that a union-run
meeting? Yeah, there's lots of unions that are on board, but there's a huge coalition of
community groups.
Community groups.
And that's at United Hall, which is also sometimes called Teamsters Hall, across from Teamsters at 333 South Ashland.
Right.
And there's a parking lot there, too.
Yeah, there's a parking lot. So please come to that. That's very important. And I'm going to be pushing there for a day of rallies here in Chicago, too, to correspond to the National Day of Rallies, so that we can have some local...
united...
Yeah, local pressure, too.
It's not a bad idea. Not everybody can get to Washington.
Right. Not everybody can get to Washington. Then I really, really recommend that everybody call Congress every day. I call 5, 6, 7, 8 representatives and senators every day. I start off with Illinois, and I go on with that.
You are such a maniac, Dr. Laura.
Well, this is the deal.
I love that about you. I've done a lot of Washington calling myself.
Exactly. So I'm going to give an 800 number, and that is 866-338-1015. 866-338-1015.
And that gets you to what? The switchboard?
And that gets to the congressional switchboard, right. And people often ask me, how do you call so many reps and senators? You know, they're going to just hang up on you or whatever. Well, I actually look up zip codes in their district. If you go on the House.gov and Senate.gov, you can click on their websites, each representative and senator's websites, and you can go to their district offices, and they've got zip codes right there. So I just pick a zip code, and I tell the people that I'm from that zip code.
In other words, you lie.
Absolutely. No question about it.
We're not really pushing that on the radio. I'm sorry. I know it's okay in some corners, but I do think it's a slippery slope. Okay?
We're desperate out here for medical care.
Let me just say that much. All right. We're going to be cut off soon by our third guest. So
okay, absolutely. So let me tell a little bit more. So I want to go through the absolutes here. The absolutes.
The must-haves.
The must-haves.
Okay.
If we're going to, so the House is going to come out this week with their version of the plan. It's a tri-committee plan, and we're not. We think we know some things about it, but we don't know that much about it. The Congressional Progressive Caucus, which has 80 members.
And that's the Jan Schakowsky bunch.
Jan Schakowsky, Luis Gutierrez, Danny Davis, Jesse Jackson Jr., Bobby Rush. They're all on it. They have come out with a list of must-haves, and I definitely recommend people go on. If you Google Congressional Progressive Caucus, you can find this. And basically what they're asking for is a strong public option that's tied to an existing federal program like Medicare or Medicaid, that there's no triggers, and a trigger is that the health insurance companies have not been able to control their costs voluntarily, so eventually down the way we get some kind of public option. That's BS. That's total BS. No mandates, no mandated insurance. We don't want a captive audience that are going to be taking our public dollars and funneling them to the private insurance companies. No mandates. If this is going to be a strong public option, it's going to be viable because it's going to be so competitive with the private health insurance companies. And no means test. We shouldn't have to be poor to buy into this, because we want a strong public option. That means lots of healthy people too, lots of, a broad section of American society. So no means test. And we want, and I just recommend that everybody go on the Congressional Progressive Caucus and read their letter, Principles for a Public Health Care Option. I strongly agree with them. And so I recommend that you rally for single payer. You tell people when you call in Congress, yes, single payer is the best, but then you also add this nuanced call of no mandates, no triggers, no means test, strong public option, and then our next move will be to, if we get a strong public option out of this mess that's going on in Congress, then we would go around this country and sign people up. And yes, drive the private health insurance companies out of business.